Discussing the picture exchange communication system, both for verbal and nonverbal students with autism spectrum disorders, or ASD. As a teacher of special education self-contained classroom, it is very evident that there are a multitude of reasons to use the picture exchange communication system, or PECS, in the school daily. PECS has a place and a use for both verbal and nonverbal students, not only in the special education classroom, but also in pull-out therapy sessions, the general education classroom, the cafeteria, and pretty much anywhere else that students go inside and outside of their school environment. Anyone working around students should be aware of the student's use of PECS and should be trained on how to respond accordingly. This will help to ensure that the voice of the student is heard. With consistency, students can master PECS, thus giving them a form of communication and acceptable interaction with the outside world. PECS is a system whose effectiveness has been researched with several groups of students, including those with ASD. Once students realize that PECS gives them an acceptable form of communication with others, they will be more at ease and less stressed. Their anxiety with the known and unknown will decrease. No two students are alike. Each learns at his or her own pace, in his or her own way. Knowing this, educators must strive to differentiate instruction to accommodate the student's needs. PECS is not one size fits all. Although there are many ideas about how to help students with autism spectrum disorder, or ASD, learn to communicate effectively, PECS creates a functional means of communication for individuals with a variety of communication challenges. Autism spectrum disorder is a range of situations that lend themselves to having difficulties with social skills, repetitious behaviors, speech, and nonverbal communication. There is not one autism, but many types that include classic autism, Asperger's syndrome, and pervasive developmental disorder not otherwise specified, or PDD-NOS. Although neurological by nature, these disorders can be caused by different combinations of genetic and environmental factors. Characteristics of autism spectrum disorders can normally be lumped into three main categories: social behavior and social understanding, restrictive behavior and play, and speech and language. Social behaviors and social understanding consist of unusual or inappropriate gestures and movements, a lack of interest in others and activities, and a lack of desire to participate in social interactions. Children diagnosed with ASD often have difficulty in understanding and expressing feelings. They also have an aversion to being touched, in part have difficulty making and maintaining meaningful relationships with their peers. Restricted behavior and play deals with repetitive body movements that are often observed with ASD. Children with ASD are often rigid and obsessive in their movements and activities. They can easily become singularly focused on certain topics or objects. The objects of interest are normally of unusual nature, such as light switches or rubber bands. Many times these children will self-stimulate by spinning objects or sensory input. Every child with ASD reacts differently to sensory input. They can be hyperreactive or highly sensitive, or hyporeactive, which is low sensitivity. Speech and language difficulties also often occur because of ASD. Symptoms of these Speech and language problems include, but are certainly not limited to, delays in speaking. This normally occurs after 2 years of age if the child learns to talk at all. Children who do learn to speak tend to speak in unusual tones with odd rhythm and/or pitch. They also tend to repeat words and phrases and have trouble starting and engaging in conversation with others. Children with ASD-related speech and language conditions also have difficulty in understanding simple statements, questions, irony, and sarcasm. They tend to take language very literally. In addition to social behaviors and social understanding, restricted behavior and play, and speech and language difficulties, children with ASD also exhibit other related signs and symptoms of the disorder. While not part of the general autism spectrum disorders diagnosis criteria, children with autism can suffer from any combination of sensory problems, emotional difficulties, and irregular cognitive abilities. It is these other related symptoms that often bring unwarranted stress and anxiety and cause behavior issues in the school setting. The road to getting an ASD diagnosis can be very time-consuming. The main diagnosis consists of multiple evaluations performed by a team of psychologists, psychiatrists, service providers, pediatricians, neurologists, audiologists, and special education teachers. During the evaluation process, parent interviews are conducted. There are also medical exams, lead screenings, and hearing tests. Children suspected to have ASD are also observed by developmental specialists to determine any delays. Depending on the severity, children may also be given speech and language evaluations, cognitive testing, adaptive functioning assessments, or sensory motor evaluations. Although there is no known cause for autism, historically, refrigerator mothers, or mothers who didn't show any affection, were thought to be the cause. Research shows that genetic and environment issues are to blame. Vaccines, vitamin and mineral deficiencies, food allergies have also been thought to contribute to the cause of ASD. Researchers are continually developing new theories as to the exact cause. Communication is vital. The process of teaching students with autism spectrum disorders to communicate is best done using consistency. The Picture Exchange Communication System, PECS, is the answer. Since its development in 1985, PECS has been the focus of many research studies involving children and adults with ASD, both verbal and nonverbal. Traditional communication techniques rely on teacher-initiated social interactions. However, PECS teaches functional communication with a primary focus on unprompted communication. PECS will teach new communication skills to students with autism and allow them to make positive changes in their home and school environments.